experiencing a strain on healthcare capacity, especially where vaccination coverage is lower. This is both a reminder of the importance of vaccination in our public health toolkit and then reinforcement of the need for ongoing vigilance with other measures to prevent and quickly respond to the rapidly spreading Delta variant. Nationally, the average number of daily new cases being reported is over 4,300. On average, over 2,200 people with COVID-19 are being treated in our hospitals each day, including over 700 in intensive care units, and an average of 36 deaths are being reported daily. These cases and severe illnesses are predominantly occurring among unvaccinated people. From early August to early September, the average weekly rate of new COVID-19 cases was 11 times higher, while the average weekly rate of hospitalizations was 38 times higher in unvaccinated people than in fully vaccinated people. This week marked the start of fall, and as we've already begun the move indoors for back to school and return to work and social spaces, increased disease activity is not unexpected. This means we must keep up efforts and use everything in our toolkit to slow the spread as much as possible to protect lives and livelihoods. COVID-19 vaccination is proving very effective, particularly in preventing severe outcomes, and especially where coverage rates are highest. Although we need very high coverage to offset the highly contagious Delta variant, the good news is that we are continuing to make progress in getting more people protected every day. There are now over 26.5 million Canadians fully vaccinated, which is over 80% of the eligible population aged 12 years or older. On the flip side, that leaves more than 6.5 million Canadians still needing one or more doses of COVID-19 vaccines to be fully vaccinated. Like COVID-19 disease activity, vaccination coverage is not the same everywhere. Where there are gaps in coverage, there will be impacts at the individual level, at the family and community level, and across society and shared services, including healthcare capacity for everyone. As always, our collective efforts matter. We can all help by protecting ourselves through vaccination and indirectly protecting others who can't be vaccinated or who don't mount a strong response to the vaccines. At the same time, our efforts can keep schools open and minimize disruption of vital economic, social, and healthcare services. If you aren't fully vaccinated yet, please access the information and supports needed to join the vaccination firewall. And whether you are vaccinated or not, we need everyone to keep up with individual precautions, including masking and spacing, that help prevent exposure and spread of the virus. Thank you. Merci, Miigwech.
Bonjour à toutes et à tous.
Good morning, everyone. The latest surveillance data show that while the Delta-driven wave is continuing nationally, there is considerable regional variation. Areas that have achieved high vaccination coverage and maintained masking, spacing, and other measures where appropriate, have been able to keep infection rates lower to protect the health system. However, some more heavily impacted areas are experiencing a strain on healthcare capacity. This is especially true where vaccination coverage is lower. This is both a reminder of the importance of vaccination in our public health toolkit and a reinforcement of the need for ongoing vigilance with other measures to prevent and quickly respond to the rapidly spreading Delta variant. Nationally, the average number of daily new cases being reported is over 4,300. On average, over 2,200 people with COVID-19 are being treated in our hospitals each day, including over 700 in intensive care units, and an average of 36 deaths are being reported daily. These cases and severe illnesses are predominantly occurring among unvaccinated people. From early August to early September, the average weekly rate of new COVID-19 cases was 11 times higher, while the average weekly rate of hospitalizations was 38 times higher in unvaccinated people than in fully vaccinated people. This week marked the start of fall, and as we've already begun the move indoors for back to school and return to work and social spaces, increased disease activity is not unexpected. This means we must keep up efforts and use everything in our toolkit to slow the spread as much as possible to protect lives and livelihoods. COVID-19 vaccination is proving very effective, particularly in preventing severe outcomes and especially where coverage rates are highest. Although we need very high coverage to offset the highly contagious Delta variant, the good news is that we are continuing to make progress in getting more people protected every day. There are now over 26.5 million Canadians who are fully vaccinated. This is over 80% of the eligible population aged 12 years or older. On the flip side, that leaves more than 6.5 million Canadians still needing one or more doses of COVID-19 vaccines to be fully vaccinated. Like COVID-19 disease activity, vaccination coverage is not the same everywhere. Where there are gaps in coverage, there will be impacts. At the individual level, at the family and community level, and across society and shared services, including healthcare capacity for everyone. As always, our collective efforts matter. We can all help by protecting ourselves through vaccination and by indirectly protecting others who can't be vaccinated or who don't mount a strong response to the vaccines. At the same time, our efforts can help keep schools open and minimize disruption of vital economic, social, and healthcare services. If you aren't fully vaccinated yet, please access the information and supports needed to join the vaccination firewall. And whether you're vaccinated or not, we need everyone to keep up with individual precautions, including masking and spacing that help prevent exposure and spread of the virus. Don't forget to frequently wash your hands, to wear a mask, and to maintain physical distancing. Thank you.
Merci, Dr. Tam and Dr. New. Thank you. We will now open the phone line to questions. We ask that you limit yourself to one question and one follow-up. We will be taking your questions in both official languages. Nous allons prendre des questions. Nous vous demandons de vous limiter à une question et une question de suivi. Vous pouvez poser vos questions dans l'une des deux langues officielles. Operator, first question. Operateur, première question, s'il vous plaît.
Thank you. Merci. You may press star 1 if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. The first question is from Sophia Harris from CBC News. Please go ahead.
Hi. Just checking if there's been any progress in talks with other countries, including the U.S., on accepting Canadian travelers with mixed vaccines.
Yes, this is Teresa Tams. Thank you for the question. And we have been undergoing very active engagement with other countries, including the United States. We've been presenting our data, for example, in the vaccine effectiveness of the mixed dose schedules, such as AstraZeneca, followed by mRNA vaccines. And the European countries and other top destinations for Canadians. So those are, I think, progressing pretty well, but every country is trying to figure out right now the vaccine requirements. And the US, as you've heard, is just beginning to pull together their policy pertaining to vaccine requirements for entry through the air mode. So we're still working with them on this front, but we have provided information and linking with our counterparts at the CDC, at the HHS, and the NIH to facilitate their decisions. Some of the European countries, of course, have already accepted this mixed schedule because they themselves also utilize such schedules. But we still have to advise travelers that they must check in with the specific country requirements prior to travel, because it is a bit of a varied landscape out there, but we're doing everything that we can to facilitate that recognition.
Follow-up?
Yeah, just with the U.S. requirement, is that their vaccination requirement coming in, is that something Canada is really concentrating on with the U.S. about accepting mixed vaccines?
Yes, we have had quite a series of discussion with U.S. counterparts. Right now, it's not the issue isn't with the mRNA vaccines in terms of interchangeability. It's, for example, they have not used AstraZeneca vaccine in the United States, and certainly not a mixed dose schedule. And as a result, they don't have domestically generated information on that front. So we've basically been providing some technical support to help them make a decision on the mixed dose, particularly AstraZeneca, followed by an mRNA vaccine. So I understand that they are still in the process of deliberation.
Thank you. Merci, operator. Next question, please. Prochaine question, s'il vous plaît.
La prochaine question est de Louis Blouin de Radio.
The next question is from Louis Blouin, Radio-Canada. Good morning. A question for Dr. New. Dr. New, do you see a way to slow down the worrying trends in Alberta? Is it too late to go backwards there, because we're seeing a very serious impact on the hospitals in Alberta? Do you see a way to reverse the trend with additional vaccination, for example, or is it too late? Thank you for the question. It's difficult for me to comment on the situation in a specific province or territory, because it's really the public health authorities in that area who are on the ground and who have a more detailed view of the situation than I do. But what I can say is that we know that delayed indicators like hospitalizations or deaths always show what's happening a couple of weeks after the levels of infection. So we're following closely what's happening in Alberta. We know that the health system there is reaching its limits, and there are high numbers of hospitalizations, a high number of people in the intensive care units. And for the federal government, we're always ready to offer support and provide the necessary support with the request from Alberta. And I understand that the government of Alberta has made a formal request to the federal government. And so we are currently discussing what exactly are the needs there and how we can meet them. But what we've seen over the last few days is that Alberta has put in place additional measures, such as requiring masking, and also a system. I know they're explaining it as being sort of a system for verifying proof of vaccination for certain non-essential services like restaurants. So those are measures that will help to prevent future cases and community transmission. But in terms of what's happening right now, that's really, well, for us, we will continue to offer support to Alberta with their needs in their healthcare system. Thank you. I understand, new question. I understand that the rate of vaccination in Alberta is insufficient. What would you say to Albertans who are still hesitating, who still don't know if they'll get vaccinated? Answer from Dr. New. Well, I would say that at the federal or the national level, it's not just Albertans, it's all Canadians. As we've said today, there are 6.5 million Canadians who, across the country, who are eligible for vaccination, who have still not received either a first dose or who are not fully vaccinated. So this is a major issue. We've also seen that there's a distribution across the country, and we know that there are young people and some rural areas where vaccination rates are not as high. So we know that our counterparts in the provinces and territories are continuing to work to find solutions and new ways to encourage vaccination among certain groups who are still reticent. But beyond that, we are seeing right now across all the provinces and territories that new tools are being used, like vaccine passports in Quebec, for example. And I've seen what's happening in Quebec. Things are going relatively well in Quebec, and I spent personally a weekend in Montreal, and I used the vaccine passport in Quebec, and it was great. It was easy to use, and it was good to see that, it was reassuring for me to know that everyone in the restaurants like me was fully vaccinated. It's really reassuring to know that everyone around me is fully vaccinated, like me, if I go to a restaurant, for example. So I think we need to continue those sorts of efforts across the country. Thank you.
Merci. Operator, la prochaine question. Next question, please.
The next question is from Peter Zamonjic from CBC News. Please go ahead.
Hello, can you hear me? Hello?
Yes, we can.
Okay, great. This is a question for Dr. Tam, please. Ontario is increasing the capacity of fans that are allowed at indoor pro sports venues, and Alberta is going to be holding full capacity NHL's games. Could you please tell me what you think the level of risk at this point in the pandemic is to holding such events in such capacities?
Maybe I'll start. I know Dr. New is always on the sports files, so he may have other things to add. And we've emphasized that, of course, some of these decisions are really based on a provincial examination of their own data and the epidemiology, which is clearly different between, for example, Alberta and Ontario. Ontario is actually doing pretty well in terms of the current epidemiology. Of course, there are cases, there are increases, but things are generally well managed, and there's been a significant uptake in vaccinations. Based on what I understand, they too are looking at the vaccine proof or vaccine requirements for sporting events. So they are putting down those kind of mitigation measures, as well as looking at capacity size. And the two all of these pieces have to be examined together. So if you are requiring vaccine proof or testing, then you can adjust your the size of the audience, if you like, and also based on the size and capacity of the actual space that you're in. So it's probably a fairly complex piece of calculation, but I think the Ontario authorities have looked at the current situation and felt comfortable from that perspective to move on to expand some of these gatherings. But I know that my counterparts are watching what happens very carefully, and I'm certain they will reevaluate if those capacity objectives, if you like, need to be adjusted over time. But we do know that vaccinations are very effective, and it's possible that this requirement to have a vaccine proof for such events can stimulate a younger adult population from getting vaccinated as well. So I think certainly contact Dr. Kieran Moore or others for their perspectives.
Yeah, it's Dr. New. Maybe I'll just add a couple of points to what Dr. Tam has said, which I think really covers the waterfront. I would say that with all of the professional sports leagues and teams that we've been dealing with respect to COVID-19, I think by and large, I think they've been very receptive, and they understand the gravity of this global pandemic that we're all facing. And you can see by the sort of the policies they put in, even for their own personnel, the players and so on, in terms of requirements for vaccination. Looking at the NHL as an example, I think that's very good. So from a health and safety protocol, I think they've done all the right things, and we continue to work with them to see if there's any adjustments that might need to be made down the road. With respect to spectators, that's another issue, and as Dr. Tam pointed out, that's more within provincial jurisdiction in terms of, like any other sort of a mass gathering event that needs to be looked at closely by local public health officials, taking into account local epidemiology and so on. A very important component of that is, of course, proof of vaccination, and it gets back to the issue of vaccine passports, and that being a tool to motivate individuals that for no other reason than wanting to go to a baseball game or a hockey game, that it would be obviously important to get vaccinated. So I think there's lots of issues in play from a quote scientific, technical, perspective. For example, if you're looking at a Blue Jay game that might be taken sort of in an open air stadium if the roof is open, compared to a sort of a more of a closed setting in terms of a hockey arena. That there's other things that need to be looked at in terms of ventilation and so on. But I think the main principles of looking at vaccination proof for the spectators, as well as the use of other measures like the use wearing of masks being mandatory, are all part of it. And at the end of the day, I think it's a decision to make that looks at all of the factors, and then of course a certain level of risk tolerance involved as well. So I'll leave it at that. Thank you.
Thank you. That's all I have.
Thank you very much. Operator, next question, please. Prochaine question.
La prochaine question est de Olivier Ferron-Boissé de TVA.
Next question from TVA Nouvelle. Good morning, Dr. New. In your opinion, with the data that you have in front of you and the trends that you're seeing, is the level of vaccination that we have reached enough to avoid a situation where we would have to recommend closing schools in a number of regions or having measures that would lead to another confinement? Well, thank you for the question. Answer from Dr. New. If we look at the data, we know that with the Delta variant, which is very contagious, I believe we need to continue to increase the level of vaccination coverage. We talked earlier about a level of 80%, but I think a majority of experts now think that we need to reach a higher level of vaccination coverage, 90% or higher. Dr. Tam and myself have always said that if we could reach, I know it's a dream, but 100% vaccination coverage, that would be the ideal. But in terms of what we can do to avoid more serious consequences for fall and winter, I will continue to highlight that it's very important that in schools certain measures be put in place. But if we see cases in schools, for me, that really reflects what's happening in the community with community transmission. I've spoken with my counterparts, and we are starting to collect data, but what we're seeing is that there are a lot of cases in children which come from families where there are non-vaccinated family members. So the best way to protect children under 12 who are not currently eligible for vaccination is to get vaccinated. It's very important that all adults around those children, whether it be staff in school or other family members, they must be vaccinated. That's the most important thing that we can do to prevent spread and to keep schools open this fall and winter. Thank you. Follow-up question from TVA. To go back to the question about sports, the National Hockey League is starting to plan for numbers of people who will attend various games, and we're seeing that provinces and teams in the United States are expecting to have full houses, whereas in Montreal, we've so far heard just a third of capacity. So even if in Quebec there's a higher level of vaccination in Quebec than in the United States. So my question is, in Quebec or in Canada, are teams being over-prudent, or are teams in the United States or other areas being irresponsible with having full houses, especially when they have lower vaccination coverage rates? Well, there were answer from Dr. New. There were a few questions in there. There are thresholds for risk tolerance, and what I can say is that when it comes to National Hockey League teams, there are some good protocols and there are vaccination requirements for all staff and players, and there are good protocols that are in place in terms of, for example, players' behavior, what they can and can't do. And that's true for teams in Canada and also for teams in the United States. So what I've seen is in terms of protecting the health and safety of players and Canadians, well, in terms of players crossing the border, that's not really a concern. But to go back to your question about capacity in arenas, well, I think that the most important thing is to ask, what tools do we have that can we use to minimize or manage risk? And once again, vaccination is the most important tool. So proof of vaccination, a vaccine passport for all spectators who want to attend a sporting event or a hockey game, that's number one, the most important tool. But there are other public health measures, even at the individual level. We've always talked about masking, and hand washing. We need to continue those efforts. And beyond that, I think at the end of the day, it's really a question of risk management, because we know that physical distancing is also an important tool in the toolkit, and good ventilation. So that's something that public health officials will have to take into consideration when it comes to making decisions about capacity for a hockey game. But beyond that, we know exactly what we can do, and I think that if we start with the highest possible rate of vaccination, that's a good starting point. And so I'm not really too worried about what's happening in the United States when it comes to spectators and for players and teams who are crossing the borders. We have good protocols in place to protect those teams and also to protect Canadians here in Canada. Thank you.
Merci beaucoup. Operateur, on peut aller la prochaine question. Next question, please.
The next question is from Jamie Morashi from Global News. Please go ahead.
Hi, all. Can you hear me okay?
Yes, we can.
Wonderful. So the WHO today has endorsed the treatment of monoclonal antibodies, but here in Canada, we have just a few thousand doses, Global News has confirmed. So why haven't we procured more?
Sorry. Hi, this is Teresa Tams. So obviously, there's a range of treatments and not just monoclonal antibodies. And so we have been trying to have an ongoing access to safe and effective therapies as they're being authorized from a Health Canada perspective. So, working with Public Service and Procurement Canada. So there are different ranges of treatment. And so this is not the only one. So we have, of course, the remdesivir, and then other drugs such as tocilizumab, some anti-inflammatory drugs, and antibody combinations. And there are different ones of those as well. So, but what fundamentally determines, the appropriate acquisition administration is through discussions with provinces and territories about their needs. Of course, in a global situation, there's always, demand. But fundamentally is through a discussion with provinces and territories about what they need and their allocations. But of course, we, just like on the vaccine front, pulling all stops to get different doses of these range of medications. So it's not the only drug that we have.
Sorry, just to follow up, I completely understand it's not the only drug that we have, and I'm aware of the other drugs in play here, but I'm talking specifically about, something for earlier treatment, especially for those who are potentially immunocompromised. This has been put forth now as a really viable option. Is it the cost that's kind of setting us back? What is it? What's the reason that we haven't garnered more, I guess?
Yeah, I think it's different factors. It's not really fundamentally about cost. There's access, but also feasibility of delivery. I think there is more opportunity now. For example, one of the antibody combinations used to have to be given intravenously, and there's new data to show that you can actually give it under the skin now. And that might then increase the feasibility of the use of these medications in the frontline setting. So, these are evolving applications. But I do think that these treatments play a really key role in our response overall. So it's great that you brought it up, because it should be part of the armamentarium, as it were, to combat this virus. So they are available, but sometimes the demand has not been great from the provinces, but is the reality of the application and the feasibility issues that they face as well.
Thank you. Operator, we can go to prochaine question. Next question, please.
The next question is from Laura Osman from the Canadian Press. Please go ahead.
Good morning, Dr. Tam. I wanted to start by asking you a question about a story that CTV reported about a batch of expired vaccines that went to Ontario First Nation and were administered. First of all, do you have any more details on that? And secondly, what does that do in terms of the relationship of trust with that First Nation and others that you are trying to encourage vaccination in?
Thank you for that question. And I actually was not aware of that very specific situation. But of course, it's very important to, there's a very complex vaccine program that's being delivered on the ground through the provinces and territories. So I think it is very important to have checkpoints to ensure that whatever's being delivered is within the expiry date. So, but I do know that in such a massive undertaking, there could be challenges and issues that will come up. So I think the most genuine way of tackling the issue is having had it identified is for the various key leadership and people trying to deliver the programs to sit down together and understand what actually happened and find a path forwards. So with the intent to prevent any situation like that. So I can't speak to exactly what happened, but it's true that sometimes these incidences do lead to a lack of trust, and which is already very difficult to build. But I think everyone should come to the table with an open mind to look for prevention measures for the next time. But of course, I'm not involved in the specific incident that you discussed, so I can't comment on that.
Fair enough. Thanks so much for that, Dr. Tam. I also wanted to ask you, with the news about Pfizer having more data regarding younger children and the safety of their vaccine and the efficacy, a lot of parents are starting to think about the choice they're going to make for their children. I understand Health Canada hasn't approved the vaccine for young kids yet, but how would you encourage parents to begin thinking about vaccinating their children, given that kids are lower risk, the higher transmissibility of the Delta variant, and myocarditis concerns that were brought up by JCVI in Britain for kids 12 to 15?
Yes, thank you for that question. It is one of the key pieces of vaccine program discussion that is to come for the National Advisory Committee on Immunization. And you just brought up some of the key considerations, which is the balance of risk-benefit must weigh towards the benefit. And all of those considerations you've mentioned needs to be taken into account. And the objective of whether we're preventing transmission of the virus to the individual protection as well. With a very transmissible virus, variants such as the Delta virus, even rare events, of course, can surface and become more common. So we will see children in hospitals, as well as some rare but serious cases, and the numbers of those can be significant if there's a lot of viral activity. So that's to be taken into account. The other factor that is being considered, of course, is the issue with the evolving science around long COVID or post-COVID syndrome. And that question pertains to, what if you only got a relatively mild illness, but still can have months of ensuing consequences? So it's not just the acute illness, but other impacts. This has then got to be weighed against significant social, educational, developmental impacts, mental health on children for missing schools. So another factor that has to be built in is the minimizing societal disruption, which for kids is about education. So it is a complex set of factors, but all of these, and including ethics, will be factored in along with safety and efficacy. I think parents are mostly concerned about safety of the vaccines. So we do have to see the data from the manufacturer being submitted to Health Canada and move on accordingly. We are, of course, tracking the one age group up, which is the 12 to 17-year-olds. And so far, those programs are going well. There's no specific safety concerns, although myocarditis is something that we're monitoring both in youth and in young adults. And these events have to be tracked on an ongoing basis, and we can adjust recommendations accordingly. So I do think that seeing the safety data in the younger children is of paramount importance, and then balancing it out with all those factors that you've actually also identified. But I think all of my counterparts and the provinces and territories, their prime objective this fall and winter season is keeping kids at school. So I think that will float to the top of the considerations.
Thank you very much. Proszę question operator. Next question, please.
The next question is from Jeff Labine from iPolitics. Please go ahead.
Dr. Tam, just keeping on the theme of children here, what are your thoughts on mandatory COVID vaccine for eligible school children?
I think taking things one step at a time is, of course, getting the data on the safety of the vaccine and their immune response in children. So that is step number one. In terms of program implementation, that is in the realm of the province and the territory. Vaccine proof and vaccine requirement has been part of the daily lives of school kids for other vaccines for example, in Ontario. So this is not that different, perhaps, than other vaccine-preventable diseases. So this would not be new for the school to take up that requirement. And based on experience with other childhood vaccines, having that requirement and the showing of vaccine proof does serve as a very important reminder to parents and can increase vaccine uptake. So I think provinces will be considering this as one method of ensuring vaccine uptake and safety of the school environment. But again, we're a little bit ahead of the curve here. We have to make sure we have the data on the safety and the immune response and the other considerations first.
How quickly do you think we could implement that? Would that be a quick turnaround if everyone agrees that it's a good idea?
As you've seen with other vaccine requirements for the province and territories, they determine how they roll things out. What I would say is that with the infrastructures being built for vaccine proof, of vaccine certificates, this will, I think, make vaccine proof for school attendance relatively easy to do, having already laid out the groundworks for the systems and the records to be put in place. So if the provinces choose to go there, then I can see that from a records and a technological perspective, it should be relatively easy to do. But it's more the discussions, as you can imagine, with school boards, parents, and of course, the provincial public health departments making that decision.
Any follow-up? Okay, we'll go to the next question, operator. I think this will be the last question. Notre dernière question, s'il vous plaît.
Thank you, merci. The next question is from Christine Barak from CBC National News. Please go ahead.
Thanks for taking our questions. Dr. Tam, just to pick up on the questions of my colleagues, you mentioned that you're keeping a very close eye on myocarditis. Are the rates that we're seeing in the age group that you mentioned higher than in the general population or still within range?
So with the youngest age groups, of course, we don't have the vaccine. With the young adults populations, we are keeping a close eye on those trends because myocarditis following vaccination appears to be higher in the younger adults. So what we are seeing is the rates are not out of the ordinary from what is expected. So there's no specific signal that we didn't anticipate. But it is higher in the younger adult age groups. And we do have slightly different rates for the two vaccines that are being implemented. For Pfizer, the rate is about 1 per 100,000. And I think for Moderna is around 2 per 100,000. And we're observing more in the young adult age groups. And so with the 12 to 17-year-olds, many of this population actually started with the Pfizer vaccines. And because the Moderna vaccine was, of course, approved a little bit later. And so we are, of course, tracking that very closely. And we can adjust, of course, recommendations accordingly. But myocarditis following vaccination is observed, but rare in the rates that I've just stated. And most of these individuals make a good recovery, and that's what we've observed to date.
All right, thanks for that. Dr. Tam, the U.S. Centers for Disease Control and Prevention have approved boosters for high-risk workers, so healthcare workers, even teachers. Should Canada be moving in the same direction? What is the data telling you?
Yes, these are some of the most important decisions from a vaccine program perspective. Last week, yes, I think very recently anyways, the National Advisory Committee on Immunization made a recommendation for an additional dose for those who are moderately or severely immunocompromised. And we expect the next set of recommendations to be focused on an additional dose for those at the highest risk, particularly those who received the vaccine the earliest. So that includes, for example, those in long-term care homes or congregate living for seniors. So I expect the committee to have their deliberations completed on this group, for example, very shortly. But we are using Canadian data to look at vaccine effectiveness because we do have different vaccine approaches to that of other countries. For example, while we use the mRNA vaccines the same as the United States, many Canadians have actually had an extended interval compared to the United States. And what the data is showing us is that the extended interval produces a more robust immune response, and vaccine effectiveness is better with a longer interval. So the Canadian data must be analyzed on top of what we're gathering from the international community as well. And we are taking a thoughtful and phased approach to looking at additional doses. I think the more difficult decisions for really the general population, as I've said in my opening remarks, we're still seeing very good vaccine effectiveness on particularly on preventing severe outcomes. So I would say for the general population, particularly for adults 18 to 39, is to get your first shots, get your primary series. That's the most important, while the National Advisory Committee on Immunization is deliberating on any additional doses to the high risk.
Thank you very much. Merci beaucoup. This will conclude today's press conference. Thank you for your participation. Any additional questions can be directed to Media Relations at the Public Health Agency of Canada. La conférence de presse est maintenant terminée.
You are listening to the Public Health Agency of Canada, two top doctors in the country giving us an update on the status of COVID-19 in Canada. You heard about boosters. You heard about the percentage of Canadians fully vaccinated. I'm going to bring Karina Roman into this conversation. She's been listening live from our nation's capital. Karina, just in about a couple of minutes, can you walk me through the key points and then we'll talk again later?
Well, of course.